Hi, I'm Aubrey Gowing, and today we're going to talk about shoulder impingement. Shoulder impingement is a very common pain-producing condition that affects the front and side of the shoulder, what we'd refer to as the anterior-lateral portion of the shoulder. Impingement is literally just pinching or squeezing of the structures between two bones. In this case, we're talking about the shoulder cap or the acromion and the head of the humerus or top of the arm bone. There can be a number of causes for this impingement, this pinching of tissue. The structures involved are going to be primarily either the tendon of one of our rotator cuff muscles called supraspinatus, which travels out from across the top of the scapula, underneath the shoulder cap and attaches onto the outside of our arm bone or humerus. The tendon can become compressed between the two bones, or the bursa that sits above it, but below the shoulder cap, can become compressed or impinged as well. So let's take a look at these structures in the subacromial space. If we zoom into our model here, we'll see the tendon of supraspinatus as it passes just underneath the shoulder cap in this kind of subacromial space. We'll see this here. There's a very limited amount of space between the humeral head, the top of the arm bone, and the acromion, the shoulder cap here. And this isn't the only structure that can be impinged here. We said there's also the bursa, which is this small structure here, shown in green. So any of these structures really can be affected. Either the tendon of supraspinatus, where it travels out underneath the acromion, and we can see where the bursa is sitting below. The pain felt from impingement will usually be felt to the outside or around towards the front of the shoulder, the anterior lateral portion, but can extend down the outside of the arm as well. And this is responsible for somewhere between 44 and 65% of cases of people presenting with shoulder pain. So how do these structures become impinged? The space can either narrow between the two bones because of a shifting in the bones, or it can be to do with the tissues themselves or the position of the arm. This condition is very common in repetitive tasks, particularly overhead tasks. So people who are involved in arm-intensive activities where the arms are raised up, reaching over their head in professions like painting or plastering, or sometimes even just doing a little bit of home improvements. So let's look at the intrinsic factors. One of the things that can happen is due to inflammatory processes, the tendon may actually swell and enlarge, and that will reduce space available between those two bones and could cause pinching or crush of these tissues. It could also compress or pinch the bursa, causing a subacromial bursitis. Two other factors exist. One is the position of the humeral head. The humeral head can be raised up in its socket because it has space to travel, and if it is drawn up in the socket, then it can reduce the space between the arm bone and the shoulder cap. The other factor is the angle of the scapula. And this is oftentimes broken down into three grades, where the scapula is described as either grade 1, where it's flat, grade 2, where there's a curve, or grade 3, where it's hooked. If this genetic condition is present, the reduced space makes the client far more likely to suffer impingement symptoms.
Hey guys, I hope you can join me next year at National Conference in Adelaide. I've got two things that I'm presenting there. A workshop prior to the actual conference on self-care for therapists. Okay, so this, look, it doesn't get any more important in terms of therapist well-being. Okay, we're going to pick it apart the whole day. There's so much to address. I'm so super enthused about getting you to work as good and as effective as you can. The second day is peripheral nerve entrapments, and that is all about addressing something that goes under the radar, especially for you as therapists. So we're going to be assessing everyone's tension, and we're going to be looking for your own peripheral nerve entrapments. I can't wait to see you there. I hope you can join me.
Have you completed the Ethics in Practice requirement? Massage and Myotherapy Australia Education Committee, Ethics Committee and Board of Directors introduced a requirement for all association members to complete a module of study around ethical practice. This allows the association to assure the public that its membership holds a strong commitment to professional practice. This free module is reflective and allows therapists to review their understanding of ethical practice. New members are required to complete the module in the first year of membership and again every 3 years. Ethics in Practice module attracts 20 CPE points for members. If you are not a member, you can purchase Ethics in Practice at massagemyotherapy.com.au. For more information or to order the module, please visit the Association's website and consider joining Massage and Myotherapy Australia, the home of professional therapists.
Hey folks, Dave Sheen here from Connect. We've got Garry Lavis here today with me, having a little interview, a little quick chat. I'm going to talk a little bit about conferencing and workshops and whatnot. So where do you want to start, Gaz?
Where can we start, Dave? We've got 15 years to talk about it. So
We've got a long time.
Exactly.
Well, we'll talk about conference for a minute because, I mean, we're both involved in the conference each year. And you're currently, this will be your first year as the chair of conference, not? How many years has it been?
I think pretty much the full 15. I've been chair of the conference committee. So ever since I started with the association and my first spurt as a board member, that was the subcommittee that I got allocated to, and took on the chair of that, and it's something we've sort of stuck under my arm and run with it. It's really enjoyed it. It's been a great time.
And I've got to say, and a big shout out to other people, apart from Gaz and I, who have been to every conference.
Absolutely, love it.
For those members that have done that, that's a huge effort. And well, hopefully you're back next year. We're in Adelaide.
Glenelg.
Yep. At the Stanford Plaza in May. So apart from conferencing, just generally, what are you up to? Why are you in Melbourne? Gary's from Newcastle.
Newcastle, Lake Macquarie, just south of Newcastle, about 20 minutes south. So yeah, I'm in Melbourne this weekend to do one of my workshops, upper cross syndrome, which is all about the sort of forward head posture and hyperkyphotic thoracic spine. It's a bit of an epidemic these days with the sedentary lifestyle we all sort of live. So more and more, I'm starting to see this come through my clinic. So this
goes out on the Massage Myotherapy Australia Facebook page, but on that page it's an open page, so not everyone is a therapist, or maybe some people are thinking about becoming a massage therapist or remedial therapist or musculoskeletal therapist or a soft tissue therapist, or you want to have that debate?
Sure,
whatever.
Exactly, that's right.
So do you want to explain a little bit about Vladimir Janda's upper cross syndrome and what it actually means?
Look, the upper cross syndrome, like I said, at the moment, I'm sort of seeing it as almost like an epidemic. It's almost sort of keeping me in a job these days.
Yeah.
It's amazing over my 18 years as a massage therapist now. When I first started to practice, most of my work was due to overactivity.
Okay.
And these days, 18 years later, probably most of my work's due to underactivity.
And looking at screens and...
Absolutely. You know, the whole epidemic with the iPads, the phones. I mean, I have 4 kids, and they no sooner get home from school and they're like this.
Yeah.
iPads, devices out. I took them all to the NRL footy the other week and had to remove their iPads and their devices so they could watch the footy game.
So you're going to give us some parenting tips today as
absolutely,
well?
Absolutely, parenting tips, exactly. Yeah. So, more and more we see this, and what I like to present in workshops is what people see in their clinic day to day.
Yep.
So you can basically go ahead and attend my workshop and learn these techniques, and you put them into practice on Monday. And that's great. So that's how I try to develop my workshops, to make sure that people get as much benefit as they can. They're very hands-on. You learn lots of really great techniques and a lot of assessment skills. And again, another thing that you can implement at work, because it's the majority. I'll throw it at you, Dave. Is it a regular? For your clinic practice these days, is it a regular occurrence? Coming in with
and what I teach the cupping. So of course, having that shortened anterior.
Absolutely.
Always see it.
Yeah,
it's always there.
Exactly.
Even the students that come in, therapists,
absolutely,
you constantly see therapists who are in that sort of situation where they're very tight and sore in the anterior particularly. So yeah. What about the other workshop is on rotator cuff that you also present?
I do have a few workshops. So probably my favourite workshop, because I'm really passionate about the shoulder. I've had 2 complete shoulder reconstructions myself, so it's something I can sort of speak in experience with. But not just the rotator cuff, basically teaches us how to look at not just the rotator cuff, look at the shoulder girdle as a whole, and really emphasises the emphasis or the important role the scapula plays as the stabiliser for the shoulder, and when you get dysfunction through that scapula, how much that can contribute to shoulder dysfunction as well. Cool. Again, just through my clinical experience, particularly with the shoulder, we all talk about frozen shoulder, which is adhesive capsulitis, which is so totally focused on the glenohumeral joint. These days, just through
look out and beyond.
Look out and beyond, and I'm seeing so much more frozen scapula than I am seeing frozen, glenohumeral joint. So
Yeah,
it's,
yeah.
the scapulothoracic joint plays such a massive role in the function of the shoulder, and it's one that's sort of been ignored or left behind. We come out of school, with little experience, and we just have this focus of, supraspinatus, infraspinatus, subscapularis, and there's so much more to the shoulder than just the rotator cuff.
We're so lucky to have people like Garry in the industry who have had so much clinical experience. How many years have you been?
18 years now.
18 years practicing.
And I've just sold my practice, and going from having employed multiple practices, but having employed over 21 people at one stage, to actually walking in on the 2nd of July this year as a sole
therapist?
trader, as a therapist, and saying, here I am at work again. And
it's all your problems now.
I just love it. The stress that's come off me is incredible.
And it was a multidisciplinary clinic as well?
Absolutely, yes.
So what other modalities or techniques or therapists were?
Look, at one particular stage, our team consisted of a speech pathologist, a psychologist, a podiatrist, physios, massage therapists. It was really, really super multidisciplinary. So it's great to work in, a team and to see everybody's input into that. And, it was a really great model for a lot of years. But, it's hard being in business and owning a business, and you reach your time when you choose to move on. And I had a really great experience as a clinic owner, and I'm sure I've got some a few challenges ahead of me being an independent sole trader. So
for those that are on the other side, just starting out, I mean, have you got any tips in setting up your business since we're talking about it?
Look, I think the best.
What worked for you? Yeah.
Well, I think the best secret is to go slow. And I started off business with just myself and another physiotherapist. And we basically just evolved from there. And
do you think that physio, that relationship was in such a way that you're able to feed off each other as far as referral and so on? So that probably helped?
Absolutely.
Yeah?
Yeah, absolutely. And I think it's just the secret is just to remain positive and, put your all into it and have an open mind and be able to be willing to learn. I think that's the biggest secret of the lot.
Yeah, fantastic. So no regrets leaving
Absolutely no regrets. I've reached a different stage in my life, and it's a whole lot less stress, and I'm in a good place now. It's great.
Okay, fantastic.
Yeah.
We'll talk a little bit more about conference in a sec, but I just wanted to also mention, so as far as being part of the association, we've talked about how Garry's been part of that conference committee, but you also had a role in as part of the directorship here as well. So
absolutely. Yep.
How many years ago? It's been a few years since we haven't seen you on the board.
I think it's been 6 years since I was on the board. So I was on the board for a total of 8 years, and 4 of those as national president. So it was certainly a good ride. It was great to be involved.
Yeah.
But what's really good too is to be able to look back now and look at some of the things that you were responsible for putting in place, and just see that they've evolved, and that as the new directors come on board and the new presidents and the new people, as we have that sort of evolution of new people, it's really strive forward, and it's great to go along to the conferences, chat with these guys, and sit back and go, this is really good.
For sure.
It's great to see it evolve.
And hopefully you guys at home, if you are members of our association, if you are considering it but might feel a little bit fearful or don't feel that you've got your governance background or whatever, don't worry about it. Just be passionate about, maybe trying to get elected. And part of the initiation process with the board is actually we send you off on a governance certificate for in governance.
Yep,
so anything that you don't know, you'll learn by the end of it. So it's a really great learning process.
Yeah. And I think the important thing to really focus on too is that when you are elected to the board, is that you're not expected to know anything major, and your first couple of years are really just a learning period. If I were to look back to when my first couple of years on the board and thought, 8 years time down the track, I would have been national president, I would never have thought that.
Yeah.
But it was just an ongoing learning process, and you took on different roles and became familiar with the way the board run and worked well with the people around you, and it wasn't particularly it was a gradual step to where I got. It wasn't here and then all of a sudden up here. It was a gradual step, and those early times of learning and take on that stuff is just so important. So
absolutely. So any other advice about becoming a director?
Enjoy it. Look, it's
Enjoy it.
yeah, you got to enjoy what you do. If you look at it as a chore,
Yeah.
then you're not going to.
probably-
It's just like packing the dishwasher. Something you do that you don't really want to do. But just don't look at it as a chore, and look at it as having a good time and learning.
Yeah, for sure. So we're going to see you at Conference 2020
Conference
in Adelaide.
2020, absolutely.
Yeah. Should we let out any secrets about what's going on? I'm not too sure when this is going to air, but we've got our main opener.
Yep.
Jill
Hicks.
Yes.
Jill Hicks, which is a lady that survived the London bombing, I believe, and she's I think she's a double amputee.
Yeah, she is. Yeah.
And I've seen a few of Jill's things on the television online, and it's a pretty remarkable
Epic
story.
There's a great TED presentation that she's done on TED. So if you guys get to, if this interview should happen before conference next year. So make sure you go and check it out. It's a pretty amazing presentation. So yeah. Cool.
Exactly. Looking forward to that one.
Well, we could talk forever, eh?
We could.
We could, but we're not going to.
No, we're not.
We're going to shut this down now. So, guys, make sure, 2 outcomes of this little discussion. If you're considering becoming a director and taking the step to, rather than maybe from the back halls yelling out, saying, why aren't we doing this, why aren't we doing that, consider coming, nominating for the board. It's a great journey. And the other one is come to conference.
Yeah. See you in Glenelg next year.
It's going to be a killer. All right. Thanks, guys. Thanks
guys.
for tuning in. See ya.
Joining Massage and Myotherapy Australia is easy. Visit the Massage and Myotherapy Australia website, www.massagemyotherapy.com.au. Click Join Now, where you can either join online or download an application form. Your qualification will define which level you join: massage, remedial, or advanced member. Ensure you provide all information requested, including certified copies of your academic transcript, qualification certificate, and statutory declaration. It's important you certify documents and complete the statutory declaration. Documents can be certified by members of certain professions, such as medical practitioners and pharmacists. Also ensure you provide clinic details, first aid certificate, and insurance certificate of currency. If you choose our preferred insurer Aon, you'll be eligible to receive a discount. Once your membership is processed, contact Aon directly via the Massage and Myotherapy Australia website. Once the association receives all required information, your application will be processed. Join now and choose the Association of Professional Therapists.